All right. Hi, Carolyn. This is my assessment video of the head, neck, mouth, face, all that. So this is Sarah. She's my roommate. She's going to be my patient today. So first I would knock, and I'd come in and I'd say, "Hi, Sarah. I'm Gretchen. I'm going to be your student nurse today. I need to do an assessment of your head and your neck and your face. Is that okay?"
Totally fine.
All right. So can you state your name and your date of birth for me?
Sarah Elizabeth Capone, 09/23/1996.
Perfect. All right, so I'm going to put hand sanitizer on. I would provide for privacy. We're in our apartment, so don't really need to do that right now. I'm going to put some gloves on. And so basically what I'm going to do today is I'm just going to take a look in your eyes, your nose, your mouth, your ears, all that kind of thing. It won't be painful at all. Nothing will be too uncomfortable for you. Okay? So I'm going to start out just by kind of evaluating you. Your skin looks pink. I'm just going to feel it. It does seem to be warm. You have no sweating or anything like that. She is wearing makeup, but her lips look pink. She does not look pale or anything. I'm just going to I don't feel any lumps. Is there any pain up here on your scalp at all?
Nope.
Okay. All right, so next I'm just going to kind of palpate your face a little bit. Tell me if you feel any pain while I'm doing any of this. I'm checking her sinuses. Do you feel any pain or tightness, pressure under here?
No.
All right. Her trachea is midline, and I'm assessing for carotid pulses on both sides. They seem to be strong, bounding. I'm going to check her clavicle down here. Is there any pain or tenderness down here, Sarah?
Nope.
Okay, so next, sorry, can you tell me what today's date is?
Today's date, January 29th, 2019.
What day of the week is it?
It is Tuesday.
Tuesday. Who's the President of the United States?
Donald Trump.
Can you tell me how many quarters it takes to make $1.25?
5 quarters.
Good job. All right, so she's alert and oriented today. Her speech is clear. It's not muddled at all. And we'll move on next. Can I just look at your hands really quick? This isn't part of the head assessment, but I do like just to check cap refill down here. Does look like your cap refill is less than a second, so that is good. Sorry. So on her face, she doesn't have any hair. That should not be there because she is female, so there's no extra facial hair or anything like that. Her nails do look, she has a manicure, so there is no clubbing or anything like that. But of a general assessment, she does look healthy and hydrated. So next I'm going to move on to her face, which is cranial nerves 5, 7, and 11. So first I just want to have you, can you move your head back and forth for me? Can you do a circle? She does have good range of motion of her neck. I did check her sinuses and I did palpate her forehead, so and I did auscultate her carotid. Next I'm going to look at her ears. So that's cranial nerve 8. So gonna be honest with you, Carolyn, I cannot figure out how to use this correctly, so I'm gonna do what I think I'm supposed to do with it. So I want to tell you, or I want you to tell me what you hear. So this is what this is. It's just a tuning fork. So if I'm just gonna hit it, and you can kind of hear. I might not do it hard enough the first time, so it might take a couple tries. But so I think I'm supposed to hit it, and can you hear this?
Oh, I can't. That's cool.
Okay, and then I think I'm supposed to put it above your head. Oh gosh, sorry. Can you hear this?
Mm-hmm.
Bit weird. Okay. I'm gonna try it on this side. Can you hear that?
Mm-hmm.
And then try it up against. I don't think I did it hard enough. Oh my god.
Mm-hmm.
Can you hear that when I put it up against your head? Yeah. So that's checking the bone in your skull and making sure that it's traveling down. So did that, and now I'm just gonna take a look. So I have this cool device that's a little magnifying glass. You just turn it on. So I'm going to take a look in your ears really quick and tell me if this is uncomfortable for you at all.
No.
Okay. And it does look, there doesn't seem to be any inflammation in there that we need to be worried about. No redness. No swelling. Let me take a look at the other ear here. Yep. I do not see anything out of the normal for you. So that was good.
Great.
I'm just going to take a look at your ears. I'm pulling them up in a way just to see if there's any deformities or anything like that. I do see a couple of ear piercings, but that's about it. Let me turn your head this way. No redness, no swelling. Is there any pain back here behind your ear?
No.
Do you get any headaches back there at all?
No.
No? Okay. Good. All right, so now we're going to move on to the eyes. So that's your cranial nerves 2, 3, 4, and 6. So what I'm going to start by doing is I want you to look like at the wall behind me, okay? So don't look directly at me, just look at the wall behind me. And I'm just going to check the reactivity of your pupils. All right, they do seem to be equal and reactive to light, and I always have to hold this up. They seem to be about a 5 on the pupil gauge. So next, I want you to follow my finger, but don't move your head, okay?
Okay.
All right, does not seem to be any bouncing of her eyes. They seem to be able to focus properly, and then keep looking at my finger. All right, you did a good job. All right, so next thing I'm gonna have you do is I'm gonna have you cover one eye, and I want you to do the same things. Look at my finger. All right, now switch eyes. All right, they are able to focus equally, so that's a good sign there. So next thing I'm gonna do is I'm gonna have a look at your nose really quick. Okay, so what I'm gonna be looking for is symmetry, swelling, redness, any signs of allergies. So we're just gonna have a quick look up there. Can you look up for me? All right. And she does have a nose ring in on her right side, but I don't see any signs of allergies. Have you had any congestion lately?
A little bit.
A little bit of congestion, okay,
Yeah.
but you didn't have any pain when we palpated your nose, right?
Nope.
Okay, so that's good. So there's no inflammation. Next, I'm gonna look inside your mouth. I'm just gonna use my pen light this time. All right. Open wide for me. Her cheeks and the top of her mouth seem to be pink and wet. Can you stick your tongue out and say "ah" for me? Her tonsils do not seem to be inflamed. There is separation. Can you stick your tongue out, and I want you to move it side to side and go up and down? Good job. All right, can you do a big smile for me? And I'm just looking at her gums to make sure that there is no redness. They seem to be pink as well. Next, I want you, can you do a couple of funny facial expressions for me, okay? Can you do a big smile? Now, can you do a frown? Good job. Can you move your eyebrows up and down? All right, good job. All right. Her uvula is pink, does not seem to be inflamed at all. She does have tongue movement properly. And I don't know if I'm supposed to, it says soft palate on the rubric. I don't think that means I'm supposed to test her palate. So I'm just going to say that when I looked in your mouth, it was pink and moist and didn't seem inflamed at all. So, all right, just thank you for letting me do some tests on you, Sarah. And then I would wash my hands and document all of my findings after leaving the room. So thanks, Carolyn.